to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is physical therapist Riva Preil of Revitalize Physical Therapy to speak on pelvic floor health. Riva is a leading pelvic floor physical therapist. After graduating from Hunter College, Riva practiced at St. Joseph's Regional Medical Center's outpatient department, treating patients with various musculoskeletal and neurological disorders. Riva's passion for women's health led her to create the Pelvic Floor Program, where she treated women with bladder, bowel, and sexual dysfunction. After her experience at this outpatient facility, Riva worked at a renowned pelvic floor physical therapy clinic in New York City, where she continued to treat women with various pelvic floor disorders, including dyspareunia, interstitial cystitis, vulvodynia, pudendal neuralgia, constipation, incontinence, prenatal and postpartum conditions, pelvic organ prolapse, and chronic pelvic pain. Riva has also treated pediatric bladder and bowel dysfunction. In addition to using therapeutic exercises and manual therapy, Riva is certified in various modalities to help her patients achieve their goals. She received biofeedback certification in treating pelvic floor dysfunction. She's also a certified lymphedema therapist through the Academy of Lymphatics, allowing her to treat individuals who experience upper or lower extremity swelling. Furthermore, she is trained in craniosacral therapy to help patients with hypersensitized central nervous systems and disruptions in cerebral spinal fluid flow. To complement her clinical experience, Riva hosted a pelvic floor radio show and writes a blog on women's health. For more information, please visit her website at revitalizephysicaltherapy.com. Welcome, Riva, to the show. I'm so happy to have you on today.
Thank you so much for having me. I'm so happy to be here and sharing with your audience and your listeners.
Yes. So today's topic we're really going to focus on is pelvic floor health. And I've had, I've talked about this before in previous podcast episodes, but I think this is a topic that is not in general getting enough attention in our culture about what to do and how to heal. And it's so pertinent to women related to pregnancy and birth and postpartum care. So I'm just really thrilled to have another expert on today to share your wisdom. So I wanted to start off with just kind of letting you share what your personal story is of why you chose to become a pelvic floor physical therapist.
Thank you. So actually it's an interesting story. I love telling it. When I was in graduate school, I was in my third and final year of physical therapy graduate school at Hunter College. And at the time, one of my closest friends went through a very traumatic labor and delivery, which required her to see a pelvic floor physical therapist after her experience. I had not learned very much about pelvic floor physical therapy. It's not something that's really addressed in great detail in graduate school. And in fact, when it was addressed, oftentimes our professors would say, and if you want to go into pelvic floor therapy, you'll take continuing education classes for that. So I didn't even realize what it was. My friend turns to me one day and she says, Riva, it's so amazing that you're becoming a physical therapist because you'll be able to help women like me. And I said, but what? What are you talking about exactly? I wouldn't know the first thing to do to help you after what you've been through. And I know knees, I know hips, I know shoulders, but I don't really know much about the pelvic floor. And she told me that there's this entire specialty within the field of physical therapy called pelvic floor physical therapy, and that I should really look into it. And she introduced me to her physical therapist who she was seeing. And this woman's name is Dr. Marilyn Friedman. She's a mentor to me, truly an incredible and inspirational woman who sat down with me, explained the whole specialty to me, and referred me to some resources that she thought would be helpful for me. One of them was the continuing education class, which, lo and behold, was being held at Hunter, my very own graduate school, several weeks later. And I asked the director of my program if I could sit in on this continuing education class and get a feel for pelvic floor physical therapy, and he was happy to let me do that. And I just fell in love with the specialty. I remember calling my mother after the first day of the course and saying, Mom, I found my calling. This is this is what I need to be doing with my life. I want to help women with these very intimate and personal aspects of their life that unfortunately many women have been suffering for a long time before they're appropriately referred to pelvic floor PT. And it was just very exciting for me, and it's been an incredible journey, and I've loved every minute of it.
That's so cool. I love that. And it's, it's interesting too, like to your point, like you, even being in physical therapy school, you didn't really know much about it. So that just tells me that the average woman would not really know much about the availability of this type of specialty. Would you agree it's not really well known, or is it becoming more well known, you think?
I would definitely agree it's not as well known as it needs to be. Fortunately, within the past decade, I think it has gotten more attention. I think that it's being addressed more, both through doctor awareness, and physicians are referring people appropriately more than they used to. I think even like Dr. Oz has addressed it, something more like pop culture-y. There are references to pelvic floor therapies and Kegels even in TV shows that people are picking up on the buzz more so than 20 years ago. But agreed, there's still a lot of education that needs to be performed, and knowledge is power. And the more we know, the more we discuss, the more we educate, the more women can get helped.
I completely agree. So maybe if you could just spend a little time actually talking about, after someone finishes their physical therapy degree, there's this additional certification, postgraduate type studies that go into actually being a specialist in this area. Can you kind of elaborate on what that looks like?
Sure, absolutely. There are different ways to go about becoming trained as a pelvic floor physical therapist. I happen to take two specific institutes courses that I found very helpful and very informative. The American Physical Therapy Association, the APTA, they educate on multiple different aspects of physical therapy, and they have a lot of different specialties. One of them is women's health and pelvic floor. So I've taken some of their classes, which I found very helpful. In addition, there's a group called the Herman and Wallace Group, also known as the Pelvic Rehab Institute, and they are phenomenal. I've taken many of their courses, and they're amazing. They include all the latest research. Their instructors are knowledgeable, entertaining. The courses are just chock full of really great information and really helpful and useful hands-on tips. One of the things I love about the courses is that not only is there a lecture, but there's also a lab, and that's when we get to practice the techniques that we learn on our lab partners, on each other, and really take our ability to the next level. So those courses have been very helpful for me.
Are almost all pelvic floor physical therapists women?
That's a great question. The majority of other classmates in the courses that I have taken are women. Every so often there are male pelvic floor PTs. That is much harder to come by.
And, obviously men do have pelvic floors too. So it's not so you are learning how to treat male pelvic floor issues as well, I'm assuming. It's not just.
Yes, and the Herman and Wallace Group has an entire course that's just male pelvic floor dysfunction. I happen to not be trained yet in that. That's something that I'm career goal hoping to move towards. But the field includes male pelvic floor health. And in fact, there's been a shift in nomenclature. We used to call this specialty women's health. And as time went on, therapists realized that not all of our patients are women, and that it's not comfortable for a man who is going for pelvic floor treatment to be going for, quote-unquote, women's health treatment. And the name of the specialty has more so moved to pelvic floor physical therapy, pelvic floor health, because men have pelvic floors too, and at times male pelvic floors require treatment as well. So they wanted to not make it gender specific to make the male patients feel more comfortable as they should feel.
Right. And then, also just to put that awareness out once again for men and women that when they're having different symptoms that could be indicative of a pelvic floor issue, that this is a drug-free approach to address the symptoms and correct the underlying issue by addressing, alignment and the muscle component, nerve component, things like that, as opposed to giving somebody a prescription medication, right?
Exactly.
Yeah. That's so cool. Well, our audience is women, so we'll stay focused on women's stuff for today, but I did want to put that out there for our listeners who do have husbands, boyfriends, partners that, pelvic floor issues are for both genders. But for women, some common women health issues that are connected to the pelvic floor are things like vulvodynia, interstitial cystitis, constipation, incontinence, and these are things that you see in your office on a regular basis, I'm sure, and treat. Can you talk to our audience today about, first of all, what are those types of diagnoses, like what are they referring to, and how are they connected to each other?
Sure, absolutely. So I'll start with vulvodynia. That's the first one that you mentioned. Vulvodynia is pain during attempted penetration. Now, that could be either during intercourse, that could be a teenager who's having trouble inserting a tampon, that could be a woman who finds going to the gynecologist and having a speculum examination very painful, more so than just the unpleasant, pressure, this feels awkward feeling. And that's what vulvodynia refers to. Now, vulvodynia may be due to tight pelvic floor muscle. I've been referring to pelvic floor physical therapy. The pelvic floor, what exactly is the pelvic floor? Mm-hmm. The pelvic floor is a series of muscles, ligaments, nerves, just like you would have anywhere else in your body. And those muscles are attached to the pelvic bones. And what happens is just like any other muscle in one's body can get tight, so too can the pelvic floor muscles become tight. When those muscles become tight, then it can become very painful whenever anything is inserted vaginally. And that is what vulvodynia refers to. So the way to treat that would be through stretching the tight muscles, treating any trigger points that might be existing in those tight muscles, and helping those muscles return to a healthy, what I like to call a happy resting tone. Sometimes women, unbeknownst to them, store stress and tension in their pelvic floor muscles, in the lower half of their core. Sometimes they store it in the top half of their core, in their neck and their shoulders. And the same way, women will maybe need a massage to help treat any tightness or tension in the tight neck or shoulder muscles. So too, sometimes women need, so to speak, a massage in the pelvic floor muscles, if that is the area of their body where stress and tension is manifesting. And this is especially common with women who have jobs that involve prolonged sitting, especially if they're sitting and crossing their legs all day, which puts the pelvic floor muscles in a shortened, tightened position. That can, day in and day out, that pattern can lead to tightening overall of the pelvic floor muscles. And it's interesting, sometimes I also see that women who are involved with hardcore Pilates and they're working on keeping their core tight, part of their core is their pelvic floor. It's the bottom of the core. The abdominal muscles are the front. The back extensors are the back. The pelvic floor is the bottom of that core. And if they're spending so much time tightening the core, then they may also inadvertently be tightening their pelvic floor muscles too much, and that could lead to tightness. So that is what tight pelvic floor muscles sounds like, looks like, and it may manifest as pain during attempted penetration. Now, the next condition that you refer to, correct me if I'm wrong, was interstitial cystitis. Mm-hmm. So interstitial cystitis is actually a bladder issue. It's not totally clear what the cause of interstitial cystitis is. Theories involve that it is when there is a defect in the protective lining in the epithelium of the bladder, which can allow toxic substances from urine to irritate the bladder wall. And how does that manifest? What does that look like? It involves urinary frequency, the feeling of having to urinate very often, urgency, which is a strong sudden sense to a need to urinate without a lot of warning time. Could be pelvic pain, pain during urination, feeling of incomplete emptying of the bladder. Sometimes I have women who have been diagnosed with interstitial cystitis coming in, and they tell me that they urinate 20 times per day. They wake up in the middle of the night 3-4 times in the middle of the night to urinate, and then there's like nothing even there. They attempt to urinate. They feel like there's something there, but there's very, very little urine that actually exits when they attempt to urinate. So interstitial cystitis is, think of it as a bladder issue, which can lead to a muscle issue, to a pelvic floor muscle dysfunction. Because in that case, the pelvic floor muscles, they're sensitive muscles. If they sense something that's happening in the body that shouldn't be happening, something in the nearby region, a stressor, a trigger, the pelvic floor muscles will respond by tightening as a protective mechanism. So interstitial cystitis, which is a bladder problem, can lead to pelvic floor muscle tightening. And in that case, it may present similarly to vulvodynia, where there's pain during penetration and overall discomfort, in which case treating the pelvic floor muscles will help with the pain. Now, as far as the bladder itself, that is something that would require treatment. Most patients who come to me with interstitial cystitis are seeing a urologist who has them on various treatments or bladder installations or trying different medications, because pelvic floor physical therapy alone doesn't fix the interstitial cystitis, so to speak, but it can help treat the results of that, the effect on that it has on the pelvic floor muscles. Any questions on that? Anything that you'd like me to address further about that?
I was just thinking, is it possible that a woman's pelvic floor becomes tight and spasms for reasons that you mentioned earlier, and that could also potentially contribute to the cause of the interstitial cystitis?
It could be, but it's not as common. Usually I find that when my patients come in with interstitial cystitis, it's that the interstitial cystitis is oftentimes the cause to the pelvic floor muscle dysfunction. And there's actually a strong connection that I've seen amongst patients between interstitial cystitis and endometriosis, which is growth of the uterine lining outside of the uterus. And that is something that's typically, the symptoms are oftentimes very, very painful periods, constipation. There may be fertility issues with endometriosis. And I've seen endometriosis causing interstitial cystitis. I see a connection there. And very often when patients have that combination, they will have pelvic floor dysfunction in addition. Because think of it as the entire lower region it's like under attack. There's things going on that the body doesn't want happening there. So the muscles will react by going into spasm.
Yeah, it makes a lot of sense. And then I'm also thinking, from a chiropractic alignment perspective, if things are out of alignment in the pelvis, impacting the nerves that go to the pelvic floor muscles, those nerves are also going to the bladder and to the reproductive organs and other pelvic organs. And so there's a connection with that as well, with how well the neurology is working based on the alignment.
Absolutely.
Yeah. That's so cool. And then even constipation can be connected to having issues with the pelvic floor.
Totally. And what's interesting is that with constipation, the question you asked regarding interstitial cystitis, do you see pelvic floor muscle causing interstitial cystitis? I see more so of a which came first, the chicken or the egg situation with constipation and pelvic floor dysfunction. Because it's hard to sometimes know which one came first, which one created which. Pelvic floor muscle dysfunction can lead to constipation, and in addition, constipation can lead to pelvic floor dysfunction. Now, with constipation, it's oftentimes associated with tightness of the puborectalis muscle, which is one of the deep pelvic floor muscles. And the puborectalis muscle is a muscle that must relax in order to allow for complete emptying of the rectum and for pain-free bowel movements. If the puborectalis muscle, or even if the abdominal muscles are really, really tight, then that can interfere with emptying of the rectum, and it could be associated with constipation. I refer to abdominal muscles. If those muscles are really tight, then that can interfere with the peristalsis, with the colonic transit that occurs throughout the large intestine, aka the colon. So if those muscles are tight and squeezing on the colon too much, then that can interfere with normal transit of bowel through the large intestine to the rectum. So when it comes to constipation, there are other factors that can lead to constipation, which then can cause pelvic floor dysfunction, such as poor diet, poor fluid intake. People are supposed to have 25 to 30 grams of dietary fiber a day, drink 8 cups of water per day, so 64 fluid ounces in total. If they're lacking proper fiber, proper water, lack of physical activity, life stressors, all of these factors can contribute to constipation, which then the pelvic floor muscles perceive as a stressor, and they may then go into spasm. So it's hard to tell which created which. Did the constipation lead to the pelvic floor dysfunction, or did the pelvic floor dysfunction lead to the constipation? But in any event, pelvic floor physical therapy, which includes manual therapy, myofascial release, trigger point release, colon massage to help improve peristalsis, dietary education, toileting posture and position guidelines, all of that is addressed in physical therapy and will help irregardless of which caused which. It's kind of like we view it as let's tackle the whole problem, because at this point when we see a patient who comes in with constipation, they often have pelvic floor tightness, we want to just address all of it and any aspect. And that's one of the things I love so much about pelvic floor physical therapy is that it's holistic. It's all inclusive. It takes into account not just, well, what is your muscle tone? It takes into account what is the person eating. And we look at the whole picture and try to piece all aspects of the puzzle together to help create an overall healthier picture.
Yeah, I mean, that makes so much sense. It's not like, oh, we just have like a weak muscle hanging out in here or spasmed muscle. You know, there's a reason why this is happening. And so, you know, looking at a person's lifestyle is so important. And, you know, I love that you were talking about just, you know, the daily activities of what you're eating, drinking, you know, how you're moving. You know, it's kind of the exposure to toxins and mobility and all that stuff. And then, you know, one thing too that I wanted to just touch on is the emotional component. And you mentioned it briefly, but, you know, I've seen in my office in the past women who've had pelvic floor issues, who've had some very, you know, severe emotional and physical traumas to their pelvis with like rape, sexual abuse, things like that. Could you speak a little bit more on that?
Absolutely. I've seen very often that, unfortunately, if a woman does have a previous negative sexual experience, whether that be rape, whether that be she felt pressured into an experience that she didn't want, whether that be even a history of previous UTIs, yeast infections even, which is more seemingly minor, but perceived as the pelvic floor muscles as a stressor, I've seen very often that our muscles have really, really good memories, oftentimes better than our brains even. And our muscles want to protect us. They want to be serving to our benefit. So if one has experienced, unfortunately, a negative experience, then they will inadvertently do whatever they can to prevent that experience from happening again. In the pelvic floor region, that involves tightening, almost like a closing off, as a way of preventing anything else from entering that the body doesn't want there. And what I found is that, and the way I explain it to patients, is sometimes your body is doing too good of a job protecting you, because right now you're dating someone that you love and you want to be engaging in intercourse, but your muscle memory is one where the muscles are tight, they are wanting to protect you, and they're doing too good of a job. So it's almost like we have to retrain the muscles and change the resting tone of the muscles, which you don't even realize that that's what they're doing, to help a woman be able to experience what she wants to then experience. So yeah, and it's one of the things I also love about being a pelvic floor physical therapist is that very often it's more than just the musculoskeletal aspect. It's never just a person is never just a body in isolation. There's always so much more that a person brings to the table, and it's important for me as a therapist to try to be as sensitive as possible to whatever my patient's previous experiences are, whatever their past involves, and whatever insecurities or fears they may have coming in to a pelvic floor physical therapist, because it's not easy. And I tell myself, I try to remind myself that nobody is coming here who wants to be coming here. Anyone who's coming is probably coming because they have been experiencing pain. They have previous experiences that were difficult. They perhaps are experiencing symptoms, even if it's not an overactive tight pelvic floor, even if it's the opposite, underactive and weak, and they're experiencing incontinence. There's emotions that are involved with that. So I try to keep that in mind as a clinician, that not only am I addressing the person's physical well-being, their musculoskeletal system, but there's oftentimes psychological background that I want to try to be sensitive to as well. So that's something I just keep in mind. Obviously, I'm not a trained psychologist, and I don't ever try to be one. And if I do think that a person would benefit from speaking with a professional, then that's a conversation that can be had. But I just try to be sensitive with regards to whatever history they bring to the table.
Mm-hmm. Exactly. And I think, just for women to know, if they do have any history like that, then, pelvic floor physical therapy could be really helpful for releasing any stuck emotional traumas that are stored in the pelvis and stored in the soft tissue.
Agreed.
Yeah. All right. So I wanted to move on to our next question, focusing on how women that are pregnant and who have just given birth, what are the top 3 ways that a woman can help improve her pelvic floor muscles and actually kind of practice some prevention?
So that's a great question. I love it. I'm going to just make a disclaimer first before going into any details about exercises, that these are all just general guidelines, and I would encourage anyone before starting any exercise program to speak to their doctor, to speak to their physical therapist, because this is just general guidelines, and obviously each person is individual and their body is unique to them, and that needs to be respected. So that being said, with regards to women who are pregnancy, birth-related changes to the pelvic floor, so a word, a catchphrase that many women know about, have heard about, are Kegels. And what a Kegel basically is a pelvic floor muscle contraction, or a strengthening exercise to help make the pelvic floor muscle stronger. Now, something else to keep in mind is that women who have a history of pelvic pain or tightness in the pelvic floor want to just be mindful that perhaps Kegels aren't the best exercise for them to be doing, because Kegels further promote tightening in the pelvic floor. So anyone who has a tight pelvic floor, just as a general guideline, their exercise program would focus on downtraining and stretching the tight muscles. People with underactive pelvic floor or weak muscles would focus more on strengthening the pelvic floor muscles. So I'm going to be speaking as if we're talking about somebody who has classic underactive weak pelvic floor, which is generally what I've seen more with my patients who are pregnant or postpartum. Assuming that there's no history of tightness in the pelvic floor, pain, or anything of that nature, then Kegels would be appropriate. And now, the pelvic floor muscle is comprised of two different types of muscle fibers. There are slow twitch type 1 fibers and fast twitch type 2 fibers. The slow twitch fibers are the ones that contract for long periods of time but generate a little amount of force, so I like to call those the marathoners. The fast twitch fibers are the fibers that contract quickly and powerfully, but they fatigue pretty quickly. So I like to call those the sprinters. So what I teach my patients to do is we want to train both types of muscle fibers. So I have them doing both quick flicks, which are squeeze quickly and release quickly, as well as endurance Kegels, which are where they squeeze and hold for 5 seconds, 10 seconds, depending on what their endurance level is, which is information that I assess at a person's evaluation. We will then set the goals for what their endurance Kegel exercises should look like. So doing both types of exercises can help strengthen and train both types of muscle fiber types in the pelvic floor. And what I like to also then focus on is function, 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 because it's great if a person can do a Kegel while they're lying down on the plinth and practicing with their pelvic floor therapist. But what's really important is that they be able to do that Kegel when they're standing in line at the supermarket, while they're in the middle of taking their aerobics class in the gym, when they're lifting their child. So I try to teach patients how to do Kegels in functional positions as well, and make it something that will carry over to their life and be very practical for them. So that's with regards to strengthening the pelvic floor. That's a great way for women to rehabilitate the pelvic floor after they've gone through labor, delivery, when generally speaking the pelvic floor muscles get weaker. And a strengthening program can help with maintaining continence, with preventing prolapse, with keeping the muscles strong as they should be. A second factor, second thing to be assessed and addressed postpartum is sometimes women experience what's called diastasis recti, which is after 9 months of pregnancy and overstretching of the abdominal wall, the two parts of the rectus abdominis muscle, which attach at the linea alba, can separate from each other. And for some women, this may appear as a little herniation even. It seems like there's a bulge by the belly button, above, below, and that's called diastasis recti. And something that I focus on with my patients who have a diastasis recti after they've given birth is correcting the diastasis recti by doing specialized abdominal strengthening exercises. So with regards to prevention, what I would recommend for most women, either if they're thinking about becoming pregnant or they already are pregnant and they want to maintain healthy abdominal wall, is to do some core exercises and abdominal strengthening exercises to help with diastasis prevention, so that hopefully it won't then reach the point where they require correction. So abdominal wall strengthening is important, just as pelvic floor strengthening is important. And the third and final component that I would focus on with my pregnant and postpartum patients are actually hip and low back stretches, because oftentimes I'll have pregnant patients come in and they're experiencing low back pain, and very often it's due to tightness in the muscles, in the myofascial system, hip tightness, low back tightness, and that can create pain. So what I'll often do is I'll do manual work to help release any of the tightness within that system, and then I teach these patients how to do pregnancy-appropriate stretches. And they're like a whole different set of exercises that I'd give somebody who's pregnant versus not, based on positioning, what's safe for a pregnant individual. But oftentimes making sure that the hips and low back are as flexible as they should be helps with preventing pain and maintaining overall pelvic health.
It all makes so much sense. One thing that I heard you mentioning about doing the abdominal strengthening, can you just elaborate a little bit more about what that would look like for a woman during pregnancy? Because it's certainly different during that stage of life than non-pregnant.
Sure. I would definitely encourage any pregnant woman who's gotten clearance from her doctor to take a Pilates class. I'm sure that there are Pilates classes specific to pregnant women, I think that is a great way to strengthen the abdominal wall in maintaining pregnancy-appropriate exercises.
Right.
Because you want to make sure that you're just getting proper guidance from somebody who's keeping in mind that you're pregnant and taking all those factors into consideration. So obviously I would recommend having a physical therapist. Also would be a great way to address abdominal wall strengthening in a pregnancy-appropriate way. If somebody's unable to do that, then definitely a Pilates class that's specifically geared towards pregnant individuals is another great way to strengthen the abdominal wall.
And I know one thing that came up in a previous episode with a woman who specializes in diastasis was avoiding any type of jackknifing of legs
Yes.
during pregnancy,
Yes.
because that can just put too much strain on the abdominal wall and create a separation even before the birth.
Yes. And I also encourage most of my pregnant women to avoid vigorous reciprocal type of exercise. And by that I mean, if doing the elliptical is something that involves reciprocal movement, you want to engage in an exercise that doesn't feel like you're shifting your pelvis too much or asymmetrical, because during pregnancy, the hormone known as relaxin is circulating in much larger concentrations than when a woman is not pregnant. And what relaxin does is that it literally relaxes and loosens the ligaments in preparation for labor and delivery, because the pelvic outlet needs to expand. You need to be able to have the ability to have the pelvis separate more to allow the baby to be delivered. However, what it also does is that it makes an individual more susceptible to shifting out of alignment. And as a chiropractor, I'm sure that you can appreciate this, and you've seen women who have asymmetrical pelvises postpartum. So trying to avoid any, even cycling, I would definitely encourage most of my pregnant women who are not I need to cycle. Every now and then I'll encounter somebody who really wants to, and if overall they're healthy and pretty stable, then I'll let them do it. But I tell them, light, gentle, don't feel like you have to, be the hot shot in the class. But definitely avoiding anything that is involving reciprocal hip movement, which could lead to misalignment, is your safest bet. So a good walking program, even light jogging. Swimming is amazing for the body, for anyone at any stage of life, especially during pregnancy, because it's so low pressure on the joints, and it tends to not promote misalignment. So those are all great exercises and activities to consider as far as being pregnancy safe.
Mm-hmm. I think prenatal yoga is also an excellent one for helping with pelvic floor and abdominal wall strengthening.
Absolutely. Absolutely.
And to your point too, doing classes that are specific for prenatal or even specific for postnatal is smart. You're around other women whose bodies are going through the same changes, and you're with an instructor who is aware of these types of modifications and changes that are important for exercise during that life cycle.
Exactly.
Cool. So that was very helpful to sum all that up. I think prevention is really key here. So if we can, really work on preventing those tears in the abdominal wall or tears or dysfunctions in the pelvic floor, then that's the ideal way to go.
Agreed. I always say that an ounce of prevention is worth more than a pound of cure.
Yes, and that is so true. So, Riva, I know you do some other additional modalities in your physical therapy office that work with the pelvic floor rehab you do, and that includes biofeedback, lymphatic massage, and craniosacral therapy. So I'd love for you to just take a moment to share, first of all, what are those modalities, how do they work, and how can they be beneficial for someone who's having some pelvic floor dysfunction?
Sure. So first of all, there's biofeedback, and I joke around that one of the reasons why I became a pelvic floor physical therapist is because I get to play with really cool toys, such as biofeedback, which is basically a device which can be attached either to a handheld. There's a handheld version, then there's the more elaborate version, which actually connects to a laptop. And what it does is it then connects to the patient, and an individual can see what their muscles are doing. So like when they squeeze the muscle properly, the line goes up. When they relax and release, then the line goes down. And it's really cool because what it does is it helps connect mind to body, and it allows people to best learn how to use their muscle. Very often, people don't even know about the existence of their pelvic floor muscles, let alone how to properly use them when, say, trying to perform a contraction or a Kegel. And what's interesting is studies have shown that actually 50% of women who think that they're doing their Kegels are actually not performing it properly. They may be substituting with their abdominals or their adductor inner thigh muscles. People think that they're doing pelvic floor muscle strengthening exercises when they might actually not be, because it's very hard to identify and to know when they're using their pelvic floor muscles, just because they're very obscure muscles. You don't even really think about them functioning properly until they're not doing what we want them to be doing. So biofeedback is a great tool to help patients learn how to utilize the muscles properly, how to turn them on and contract, how to release and let go, which is necessary when trying to urinate or defecate. With regards to individuals who are pregnant, we only use external sensors. There's no internal device that we would use. Same with my pediatric patients. I also treat children who have bowel and bladder dysfunction or toileting challenges, and we use external sensors. And the kids love the biofeedback because it's like a computer game. They're basically learning how to use their pelvic floor muscles properly while what in essence is playing a computer game. And the settings can be changed so that when an individual is squeezing properly, it can look like a spaceship launching, and you'll tell the child, okay, try to get that spaceship as high as you can, or a dolphin jumping through a hoop. So there are different cool settings that we can use to help individuals learn how to use their muscles properly. So that's as far as biofeedback. With regards to lymphedema and lymphatic work, so lymph treatment is required if, let's say, a person has had a surgery that involves removal of the lymph nodes. And what that is that basically compromises the lymphatic system, which is a secondary circulatory system. It helps to return fluid to the classic arterial and venous circulatory system at the venous angle. And what happens is when lymph nodes have been removed, then the secondary circulatory system, which helps to restore excess fluid, may not be functioning properly. And that results in swelling in either the arms or the legs, depending on where the lymph nodes were removed from and where the surgery is performed. So if, let's say, a woman has had a mastectomy and she's had breast tissue removed and there were axillary lymph nodes near the armpit that were removed, then that can lead to swelling in the upper extremity, in the arm. If an individual has had, say, a hysterectomy, or for a male, if they've had a prostatectomy, both are surgeries which may involve the lymph nodes, then that can create swelling in the lower extremity, in the leg, and or in the groin. And in that case, manual lymphatic drainage is one component of complete decongestive therapy, which is the treatment approach that is used against and to treat lymphedema. Manual lymphatic drainage, one of the components, is something that is included in the overall spec of women's health, because oftentimes women who've had mastectomies or breast cancer-related surgeries require lymphatic treatment. So that's how it kind of became connected with women's health. There are occupational therapists, nurses, other disciplines can also, it is within their scope of practice to become certified lymphedema therapists and to learn manual lymphatic drainage. So it's not exclusive to physical therapy, but it's a nice tool for a women's health / pelvic floor therapist to have at their disposal with regards to helping to treat women as part of the overall women's health picture. And that's why I decided to become certified as a lymphedema therapist, because I wanted to be able to help women and men who have lymphedema. So that is a very rewarding specialty within women's health / pelvic floor therapy, and that is something that I fortunately am able to treat and enjoy treating. So that's the lymphatic massage
I have a quick
component.
question about that. What about using lymphatic massage with a new mom who's having some nursing challenges or mastitis, things like that?
Oh, that's a great question. I have never actually looked into that. I've never treated anyone who's having those types of issues, but you've given me homework. I'm going to look into that and see what research exists with regards to lymphatic treatment for lactating mothers. So thank you.
Sure. And then the last thing I know you were going to speak on was some what craniosacral therapy is and how you use it in your office.
Sure. So I love craniosacral therapy. Craniosacral therapy is an alternative therapy which is focused primarily on regulating the flow of cerebrospinal fluid by using therapeutic touch to manipulate the joints of the cranium and of the sacrum. And what it helps to do is it helps to re-regulate the cerebrospinal fluid, which is it's very subtle, it's very gentle. In fact, oftentimes patients who are receiving craniosacral therapy they don't feel it happening in the moment, but they feel better after the session. It was developed by John Upledger in the 70s. It's based on work that was done by William Sutherland in the 30s, and it's very powerful. And I find that it's especially with regards to treating patients who have had chronic pain, especially chronic pelvic pain. The way I describe it is the volume of their central nervous system is just, the volume is turned up so high, and their system is very sensitive, because anyone who's been experiencing chronic pain has a more sensitive system. And what craniosacral therapy does is it helps to turn down the volume, so to speak, of the central nervous system, which allows for improved tolerance to treatment and overall relaxation, and especially because there's such a strong mind-body connection, especially because stress affects our muscles and can lead to inadvertent tightening, as we described earlier with the overactive pelvic floor. So therefore, addressing the stress component is very crucial to helping with the healing process. And I often find that patients who, let's say, have a hard time tolerating the manual work that is typically done in pelvic floor therapy will have an easier time tolerating the work if they have had the volume of their central nervous system lowered through craniosacral therapy. Craniosacral therapy isn't the only way to turn down the volume of the central nervous system. I also very often will teach patients how to perform diaphragmatic breathing. I encourage patients to participate in mindfulness-based stress reduction. Yoga is fantastic. These are all just different options for ways to help address the stress component, which does affect muscles. So that is how craniosacral therapy can be very useful and beneficial in conjunction with pelvic floor physical therapy.
Yeah, I mean, that's just powerful. And I'm a huge advocate for craniosacral therapy as well. And I just think it's something that's just so powerful because it's really optimizing nervous system function, which I'm a big fan of as a chiropractor. So it's about really getting that movement of the cerebrospinal fluid and allowing the brain and spinal cord to get nourished, in normal manner based on the movement of the cranium and sacrum. So it's very powerful work, very gentle, very subtle, and very powerful.
Exactly. And because it's so gentle and subtle, it is oftentimes very appropriate for people who do have a history of trauma or have difficulty with having the muscles just stretch directly. This is a really nice way to prep the muscles for that type of work because their whole system is just more relaxed afterwards. So yes, agreed. Very powerful. very, very important work. So,
yeah, and that's a good point too, is like for someone who is, let's say, having a lot of pain, like the vulvodynia patient you were mentioning, where they're not interested in your hands going anywhere near their pelvic floor to do massage and stretching. So this would be a way to kind of help get some movement, energy flow, without even necessarily touching the pelvic floor directly. So I think that's powerful.
Agreed, 100%.
Cool.
It's also been very helpful with patients with bowel dysfunction, if their whole system is feeling under attack, and the large intestine is feeling, I would say, like the best way to describe it, like the abdominal muscles are tightening around the large intestine, and this is just a great way to help the whole system relax and then tolerate the work better. Yeah,
for sure. So, Riva, we have to grab our podcast episode today, unfortunately, but I'd love for you to just, leave any last thoughts that you want to share, and also how can women contact you if they need more information or possibly referrals?
Sure. Well, first, I would like to end the message being that trust your bodies. You know your bodies better than any doctor, better than any physical. If something is feeling like it's not what you want it to be, like it's not normal, if something is painful, it might not be the easiest thing to discuss it with a doctor, to bring it up. No one wants to talk about their bowel dysfunction. No one wants to talk about if they're having pain during intercourse. But that is something that if you or someone you know is experiencing, it's not just the way it has to be. And there's treatment, there's help. I've devoted my life to helping educate and treat women who are suffering with aspects of their life that they shouldn't have to be, because there are options. And that's why I'm so grateful for this opportunity to share this knowledge with you. And please, I encourage you to discuss this with other women who may be suffering in silence. And I strongly believe that too many women are suffering in silence. And the more we educate, the more we share knowledge, the more women can get help. So thank you for listening. Thank you for sharing this information with those who may benefit from it. And if you have any questions for me about referrals to somebody who treats lymphedema in your area, I'm happy to help in whatever way I can. I can be reached at Riva@revitalizephysicaltherapy.com.
Riva, thank you so much again for coming on the show today and sharing your wisdom regarding the pelvic floor.
My pleasure. Thank you so much for having me.